Good evening, everyone. Thank you for joining us at the National Health Insurance Authority for our monthly beneficiary educational session. We are in the month of August and we are in back to school preparation mode. And so this evening, our session is going to be focused on back to school health and your child. So we're encouraging you to grab your child, call a friend who has a child or who has children who are getting ready to go back to school, whether they are in kindergarten, preschool, primary school, high school, as well as even university. We want to get our children well equipped and ready for this new school year. And so this evening session, we are going to focus on back to school health and your child. And our speaker for this evening is Dr. Maria Francis. At the National Health Insurance Authority, our mission statement speaks to us leading the way in providing access to affordable, quality health care that Bahamians deserve. Our vision statement: we are transforming the healthcare system upon which the future well-being of Bahamians depend by putting our patients at the center of every decision we make. And so our core values, which speaks to who we are at the authority: we are passionate about bringing universal health care to all Bahamians. We are relentless in expanding access to quality health care through progressive solutions supported by technology. We are dedicated to delivering affordable health care through partnerships. We are committed to doing business with integrity, accountability, transparency, and sincerity. And we honor our beneficiaries by providing care and respect in all aspects of our service. And so at NHI, our wellness program is dedicated to creating a platform where our beneficiaries and the public at large are encouraged and educated on adopting a healthy lifestyle. And we focus on three major tenets. The first tenet is that exercise and physical activity should be incorporated into your daily routine. Tenet number two, we want our beneficiaries and the public to understand that food should be your medicine. And we want them to focus on their mental, emotional, and their spiritual health. Ultimately, the overall health and well-being of our nation is very important and living a balanced life. And we want Bahamians to understand the importance of this. And since our inception in 2017, we have worked hard here at the authority to deliver on the vision and to advance the path to universal healthcare coverage. And so, as a result of this, our enrollment growth speaks to the fact that we have currently over 163,000 Bahamian citizens and residents who are enrolled in the NHI Bahamas program. Our demographic is very diverse, and currently NHI has enrolled beneficiaries from 9 islands. And this breakdown includes 7,000 plus Bahamians under the age of 5 and more than 30,000 school-age children. And we call this our pediatric population, and we are focusing on that pediatric population tonight. And over 20,000 plus beneficiaries are over the age of 65. And we call those individuals or that population as precious pearls. 96% of our beneficiaries who are enrolled in the program and who are using it are satisfied with the service that they are receiving from the program. Currently, we are in partnership with 130 physicians across 82 primary care facilities on 9 islands. And we are also in partnership with 17 major labs across 21 locations. Our beneficiaries have access to their information via an electronic health record platform. And on this platform, the telehealth feature is enabled for applicable visits. Dr. Maria Francis. Dr. Francis was born and raised in Jamaica, where she attended medical school at the University of the West Indies, Mona. She completed a combined residency program in internal medicine and pediatrics at the Detroit Medical Center, Wayne State University in Detroit, Michigan. She is certified by the American Board of Pediatrics and the American Board of Internal Medicine. She is a fellow of the American Academy of Pediatrics. Dr. Francis is passionate about medical education and brings that passion into each patient encounter as she teaches her patients about living healthier lives. Dr. Francis is devoted to medicine. She loves children and enjoys caring for children of all ages. She is married with 3 children, and when not at work, she enjoys spending time with her family, relaxing on the beach, and reading. This evening, Dr. Francis is going to speak to us on the topic back to school health and your child. And during Dr. Francis's presentation, should you have any questions for her, we welcome you to place your questions in the chat feature found on Zoom as well as Facebook Live. And during the question and answer period, we will read those questions to Dr. Francis. Dr. Francis, you are welcome, and the floor is yours.
Thank you very much. Thank you. Just going to share my screen. Miss Sawyer, are you seeing my screen? No?
Oh, sorry, no, not yet.
Okay, let's see. Okay.
Okay, the slides, we can see the slides now. Yes.
Okay, great. All
Okay.
right. Thank you, everyone, for attending this session. Thank you, Ms. Sawyer, for your invitation. And thank you to the NHIA Authority for allowing me a few minutes to talk to everyone here about back to school health. So let's get started. So, how do we get ready for a healthy school year? A healthy school year starts with an annual well child visit. Children should also get a dental visit. We should encourage children and support children in maintaining good nutrition. We should also support children in staying active. They should also keep up to date with immunizations, and adequate sleep is of utmost importance. We cannot forget we have to support children's emotional well-being as well as their physical well-being. And finally, we have to partner with our children's schools. So let's start with the well-child visits. What should you expect as a parent, as a mom, a dad, an aunt, caregiver? What should you expect at a well-child visit? Well, first of all, you should expect to be asked about specific health concerns. Most times when children come in for well-child visits, they don't have an acute illness, but there may be concerns that have been lingering in the preceding months. So you should be asked about the specific health concerns, and the pediatrician or the primary care physician or the family physician would typically ask if you have any specific concerns that they can address at the time of the visit. Your child will get a complete physical examination, and the physician will also be providing some anticipatory guidance. Now, what is that? What is anticipatory guidance? Anticipatory guidance is age-specific health education and guidance. It's a proactive approach to health. It's kind of unique to pediatrics just by virtue of the fact that health needs and developmental expectations change with age. So, as a pediatrician, typically we will know at what age certain issues will arise and certain issues are concerns, and we'll address those at the well child visit. So let me give you an example of a typical anticipatory guidance scenario. So let's say mom and dad bring in a 9-year-old child for a well child visit. Child is healthy, they have no concerns, a 9-year-old girl, for instance. At the end of that encounter, typically your pediatrician will address something like puberty, because we know that at 9 for a girl, puberty is, if it has not yet started, is about to start and will maybe start within the subsequent year. So the pediatrician would take the time to talk to you about puberty, talk to you about when puberty starts and how puberty progresses, and address any questions that you may have. Another anticipatory guidance scenario may be, let's say a 3-year-old boy comes in, he's well, mom or dad brings him in, there's no specific concern. But the pediatrician will ask about his development. That's a part of anticipatory guidance because we expect at 3 that that child should be meeting certain developmental milestones. And we want to confirm that that child is meeting those milestones. And if they're not, then intervene with early intervention. So you'll expect to get your health questions answered and you will be offered immunizations. You may or may not have labs ordered. Now, I want to talk a little bit about that because I get that question from time to time. What about the labs? Labs are not always necessary at all at every well child visits. As a matter of fact, labs are rarely necessary at well child visits. Labs are not routine. Labs will be ordered if they're needed. So your if you or if a family member has a specific concern about a child and a lab will help to answer or to make that diagnosis, then a lab will be ordered. Or if the child has some physical findings when the pediatrician or the family doctor examines the child, then and the lab will help to establish a diagnosis, then labs will be ordered. But labs are not routine in children. All right. So, as we all know, nutrition is the basis of good health. So let's talk about what's in the lunchbox. What does a nutritious lunch look like? Well, a nutritious lunch can look many different ways, can be as varied as there are foods themselves, but there are some key things to keep in mind. One, homemade is healthier and often more cost effective. Fruits are better than sweet or salty snacks. Fresh is better than processed, and water is better than juice. So the Harvard School of Public Health have given us has given us some guidance regarding how to eat healthy. The nutritionist there uh, advise us that a healthy plate has fruits and vegetables making up half the plate. The more color and variety, the better. So we can extrapolate that to a healthy lunchbox, having half full of fruits and vegetables. A quarter of the lunchbox should be whole grains like whole wheat bread, whole wheat pasta, brown rice. And the other quarter should be a healthy protein. Healthy proteins can be fish, chicken, beans, nuts. And the drink should be water or milk. Now it's a little tricky with keeping milk keeping milk cool in a lunchbox. So I would say milk at home, water in the lunchbox. Now packing the lunchbox, some practical tips. Fruits and veggies can be apple slices, grapes, carrots, cucumber sticks. Whole grains can be a whole wheat bread for a sandwich, a whole wheat wrap, crackers. For the protein, it can be chicken, tuna, eggs, cheese, beans, peanut butter, for those who are not allergic. And for drinks, water. No sodas, no juice. Another thing we should skip is chips, cookies, candy, processed meats. And one way to kind of get through the morning more easily is to pack the lunch the night before and have your child help to choose the lunchbox ingredients. As we all know, another important tenet of health is staying active. So how active should children be? For young children, we really usually don't have to prescribe activity because just by virtue of them being young, they're bouncing off the walls, they have a lot of energy. So ages 3 to 5, we don't really have to prescribe how much time they spend being active or playing. Minimum 3 hours, but most of the times they'll go way beyond that. For ages 6 and up, it becomes a little more tricky because those children tend to want to spend more time on the screen, on the phone, tablets, computers. And so we sometimes have to encourage them or insist on those children getting more activity each day. The ages 6 and up should have a minimum of 60 minutes of moderate to vigorous activity on most days. And we should try to mix it up. The children can help to choose the activity that they like. Um, but any sport that keeps them active is fine. Baseball, basketball, biking, dancing, swimming, active play. The child may also choose the activity. And we should attempt to limit recreational screen time to 2 hours a day. The rest of the time should be spent doing other things, including physical activity. And when we're talking about the number of minutes, playtime and recess counts. So it's included in that time. Immunizations and vaccines. Those will be offered at the well child visit as well. Why? Why do we give vaccines? Why do vaccines matter? Well, many of us know this already, but we'll reiterate today. Vaccines are the safest, most effective way to prevent serious diseases. Measles, whooping cough, polio, meningitis, those are all vaccine preventable diseases, and those are serious diseases that can make a child very, very ill. High vaccination rates protect the whole community, especially babies and children who cannot be vaccinated. I want to reassure parents, especially now that we are getting more vaccine hesitancy. Every vaccine is rigorously tested before approval and monitored afterward. And staying on the recommended schedule gives protection at the ages children need it most. And your pediatrician welcomes any questions about vaccines. So prepare if you have reservations, if you have concerns, if you have worries, if you are unsure about vaccines, ask. Ask us at the Well Child Visit. How do they work? So since we're talking about school, we're going to stick to the school analogy. Vaccines are like teachers. They teach your child's immune system how to stay protected from deadly diseases. When your child gets a vaccine, the immune system begins to work right away. It starts to learn. And it does that by producing antibodies. It takes what is learned from the vaccine so it can be ready if your child is exposed to harmful germs. So let's take a few minutes to watch this quick video talking about how vaccines work.
Dr. Francis, we can't hear the sound.
Can't hear the video?
No, we can't hear it. You may have to click
Okay.
on share sound before you
Ah,
start the video.
okay. Let's see. Can you see the video?
Yes, we can see it. Yes, ma'am.
See it, but can't hear it.
Yeah.
Okay. Sorry. Okay. I'm not sure how to share sound. Um, but we can move on because it basically was reiterating what was presented on the last slide. All right. So we talked about vaccines. We talked about what happens at the well child visit. We talked about healthy nutrition and staying active. What about sleep? How much sleep does your child need? So ages 3 to 5 years need about 10 to 13 hours in 24 hours, and that includes naps. Typically in that age group, they sometimes take naps during the days. Ages 6 to 12 will need about 9 to 12 hours every night. And teens, 13 to 18 years, need about 8 to 10 hours every night. It's important to wind down with a calming routine. Turn the screens off at least an hour before bed, and the screens should be kept out of the bedroom. So no TV in the bedroom. Phone should be kept out of the bedroom at sleep time. The tablets and so on. Now, too little sleep affects attention, behavior, learning, and mood. So let's talk about emotional health. We talked about physical health. Emotional health is just as important. How do we help children to stay healthy emotionally? Well, we have to stay connected. Children need to feel safe and nurtured and connected with us as their parents and caregivers. We should help them to build and nurture relationships with friends and family. Play and relaxation is very important for emotional health and physical activity as well. We should make time to listen to the children. Now, that sometimes gets a little challenging because as parents, we're busy. We're trying to pay the bills. We're trying to get to work. We have our own schedules to maintain and deadlines to meet. But children need our time. They need to feel listened. They need to feel heard and seen by us. So we sometimes have to slow down to just listen, um, and pay attention to how the children are feeling and what they have to say. We should encourage open communication. If it should feel comfortable talking to us about whatever issues arise, talking to us as their parents, talking to a family member who is trusted. And we know, despite all of that, despite our best efforts, all that we give to the children emotionally, sometimes children will need extra mental health support, and we should be open to that and willing to do our best to access that for the children and to support them if they have mental health challenges. So, partnering with your child's school, as there, there is a common adage that it says it takes a village to raise a child. And it really is true. It sounds cliche, but it is true. So the school is a part of the village. The primary care doctor, the pediatrician, the family medicine doctor, basically the healthcare provider is a part of that village. And of course, as parents, you are the chiefs of that village. So as the healthcare provider, the way we communicate with the schools is through the healthcare forms. On the healthcare forms, we document child's chronic conditions and conditions that may impact children while they're in school. In addition to documenting those conditions, we provide guidance and recommendations for how they should be managed. So it's very important that these school health forms are updated yearly and remain current. It's important for all children, but especially for children with chronic conditions. Parents should attend orientation, stay engaged with the school, meet the teachers, and for children with chronic conditions, parents should try to meet the school nurse if there is a school nurse assigned to the school. And we should anticipate that some children may need extra support. Some children may struggle in school, and we should ask the school, the teachers, if extra support is available and how do we access extra support if needed. So let's reiterate, getting ready for a healthy school year, we're going to focus on the child's physical health, the child's level of activity, making sure this child stays active, focus on their emotional health, and we're going to maintain healthy connections with friends, family, and our faith communities, and provide support if needed. Thank you. I'd be happy to take questions.
Thank you so much for that, Dr. Francis. Um, we that was such a good and that was a very thorough presentation when it comes to dealing with our children. And it was applicable from children from kindergarten straight up to high school, and it also tapped into some of our collegiate students who still make up our pediatric population to a certain extent. And so at this time, I'd also like to open the floor for any questions for Dr. Francis. And while we're waiting, Doc, I'll also check our Facebook pages to see if anything came up. But I also
Okay.
have a question, Doc. I noticed on your, I think it was maybe the first or second slide, where you talked about what we should do as it relates to back to school health with all visits are important. I noticed that you mentioned a dental visit. What about eye
Yes.
examinations? When would that start for our children? When should we start?
Okay. Right. So that's a great question. So we do eye examinations in the office as pediatricians. So we'll do as a part of a well child visit, an eye examination is essential. So we'll examine the children's eyes, and once they are old enough to participate in a vision screen, then we do a vision screen in the office. If we have any concerns based on what we find in the office, then we will refer as necessary. So a child doesn't have to go to an eye doctor every year for a visit. The pediatrician is the first, or the family doctor is the first step in evaluating eye health. And if we have any concerns, then we refer.
Okay. Thank you for that.
No problem.
So I'm just checking, Doc, to see if any other questions if any questions are coming through. Again, we want to encourage those that are listening, whether you're on Facebook or on Zoom, should you have any questions for Dr. Francis, this is the perfect opportunity for us to ask questions. I know, Dr. Francis, I'll ask another question because what also stood
Yes.
out to me too when you mentioned blood work. I know
Yes.
sometimes the schools do ask for it, and I'm a mom, a boy mom of two sons, and there has been occasions where there wasn't a need for that blood work.
Right.
At what age does that need for blood work change?
So, I like this question because I've been getting that question a lot in the office. Actually, it's almost as if based on for families that I meet for the first time who had another provider in the NHI system, some people seem like they were getting blood work routinely. So when they came to me and I didn't, automatically order blood work, they were like, hold on, what about the blood work? What about the labs? But there is no specific age at which blood work becomes routine in children. The way we order blood work routinely in adults is because we're screening for certain health conditions that are common in adults. In children, they're different. They don't have those chronic health conditions that need to be screened for. So we do blood work as it becomes necessary. So let's say you come to me with your son and you say to me, Doctor, he's a very picky eater. I can't get him to eat any meat. Um, and I'm frustrated. I don't know what to do. In addition to counseling about how to encourage children to make healthy food choices and accept healthy food choices, I would say a child like that may need to be screened for anemia. Because if you can't get him to eat any meat, you can't get him to eat any iron-rich foods. He's a picky eater. He's only eating chips and fries and so on. Chances are he's anemic. So we should screen for anemia in him. But it is not a blanket approach to children, and children don't need labs routinely. Yeah. So, and that's just one example. We could do labs for other things too. There's some children who are obese, who we're already seeing signs of them being overweight and having some metabolic changes that can be consistent with metabolic syndrome. Those children we would screen for hemoglobin A1C, screening for diabetes, things like that. But children don't routinely need labs.
Okay. All right,
And
Doc.
they're,
Thank
yeah,
you. Yeah, thank you for clarifying that. And for appeasing a few of us. 'Cause I know that was a question like that. When would it switch?
right.
I
Yeah.
know what a part of your presentation covered sleep, and it was surprising to me when you said 10 to 13 hours of sleep for a
Yes.
3 to 5 year old. That's like almost all day. That's half of the day.
No,
So
there's still
if
14 hours left.
if they're sleeping all that time, when are we actually gonna get them tired to like go back to sleep?
So if they're sleeping from, say, that's a recommendation. We won't
Mhm.
always, it's not a perfect world. We won't always get to the recommendations in anything. But let's say uh, getting to bed at 8, sleeping until 6, that's how many hours? Almost 10? Yeah,
Yeah, that's
almost 10
10.
hours. Yeah, that's 10
Okay.
hours. That's a good amount of sleep. That's for most children. And children, teenagers need sometimes need more. So that's a whole other talk. But
Yes.
teenagers sometimes need more sleep as their bodies change. Yes.
Yes.
So
So,
we
so
should aim for 10 hours.
10 hours, okay.
Mhm.
And in keeping in the topic of sleep, I know melatonin has been a widely advertised supplement. A question that's placed in the chat is melatonin for children recommended?
So it is not routinely recommended for children, but it is a reasonable option for children who are having trouble sleeping. As some people may know, melatonin is a natural hormone that's produced by the body. And some children have trouble with falling asleep, and especially children with developmental disorders, autism, ADHD, those children can really struggle. So when we're choosing a sleep aid, melatonin is usually the first choice because it is a natural hormone and we're basically giving them a supplement of a natural hormone. So yes, it is appropriate to use melatonin in certain conditions. I want to also mention something since we're on the topic of melatonin. Our bodies produce melatonin naturally, um, but there's certain things that affect our body's production of melatonin, and screen time is one of them. When we're looking at the screen, our melatonin production goes down. So we need to put the screens away in advance of bedtime if we want our melatonin levels to rise and we can get to sleep.
Thank you for pointing that out, Doc, because I know we've always heard about screen time being diminished closer to bedtime, but I've never heard it broken down in its relation to melatonin, the melatonin
Mhm.
production in the body. So thank you for that. Changing the lunch box for the new school year. Should we go cold turkey?
Just clarify that question for me. What do you mean? Oh, you mean from, okay, I see what you mean. Because
Yes.
based on the recommendations, it would be a
Based on,
drastic change.
uh-huh.
Right. I think any drastic change is going to be met with a lot of resistance, and you're kind of going to defeat the purpose because the child is going to be so resistant, or even as adults, we don't like drastic changes. So I would do gradual changes. I would change one thing at a time over the course of months until we get to a lunchbox that's more healthy.
All right, Doc. Thank you for that. Yeah, I know some schools don't allow certain types of snacks and beverages. Just some schools just water. And so making that transition would would be in a good direction. And like you
Hmm.
said, take that small steps.
Right. Do it gradually. Yeah.
Yes. All right. So Doc, I don't see any other questions coming through.
All right.
Yes. But on behalf of the National Health Insurance Authority, we would like to thank you for taking time out of your schedule and answering the call to serve as our guest speaker this evening. Your presentation touched on so many points as it relates to back to school health, and so we know that the information did not fall on deaf ears. I know it didn't fall on deaf ears for me, and we're very thankful for you. And I'm sure that the nation and the public at large is thankful for the education. The information that you presented this evening will also be posted on our YouTube page. So it will be there for perpetuity for persons to go back and listen to and have access to that information. And so thank you, Dr. Francis. And
You're
I know
welcome.
I was about to wrap up, but I just saw a message, a question come through. So I will ask this question. All right.
Yes.
What age is appropriate to introducing tablets to children? And I'm guessing, I guess R. Munnings, can you confirm that you mean like electronic tablets?
I wasn't sure if that's what they meant or if it was or tablets by
Medication,
mouth.
oral, yeah.
Medication, right?
Yes. So Munnings, I'm not sure if you're male or female, but yes, electronic tablets.
Electronic tablets. Well, there is no age at which a child needs a tablet, so that's the first thing. So, um, if you do introduce a tablet, it should be the most important thing is limiting the amount of time that the child is on that tablet. So a child doesn't need a tablet, it's not a requirement. There is no reason a child needs to have a tablet. But if they are using a tablet at any time, you should definitely limit the amount of time they're spending on the tablet. So for school age children, not more than 2 hours. For toddlers, even less than that, 30 minutes maximum. Yeah. So,
Thank you for that, Doc. And I know some schools, um, our kindergartners are already exposed to using tablets at school. So I'm
right,
sure that's sufficient time at school, and when they get home, then that's
right.
opportunity to have
So
a
that I just wanted to point something out. The limit is on recreational use of the tablet. So some people will be on the tablet for school purposes, and that's fine. But for play, TikTok, Facebook, YouTube, maximum 2 hours for the older children. Yeah.
okay. Thank you very much. All right. And so persons are saying in the chat, thank you. Very helpful information, Dr. Francis. Yes, this is
You're welcome.
a very thorough session. You touched on the physical wellness, the annual wellness visits for the pediatric population. I like that you touched on mental health and making sure that we not only take time to sit down and talk to our kids, but we also get them those additional resources where if out of our hands we're not able to handle, we turn them over to the professionals. So thank you for advocating for mental health for our children, which I think is often always overlooked in our culture and throughout our world. And so
Yeah.
this evening, as we continue, we just want to just let you know what's in store here at the National Health Insurance Authority. Tomorrow, we are encouraging you to join us as we continue with our partnership with the Ministry of Tourism. Our once a month workout themed our power hour session will be held in Pompey Square from 5:30 to 6:30 p.m. downtown Nassau. And the workout focus is Zumba Fitness with Vanessa Perigord. For those that may be inquiring about parking, we just wanted to let the public know that after 5 p.m., parking is available on Bay Street and it's also very free. If you frequent Bay Street around 5 p.m., you actually before 5 p.m. it starts to become a little deserted zone. Persons are already leaving and clearing the area. And so you'll be able to find parking along Bay Street, Prince George Wharf through George Street, and the landmark for George Street is Christchurch Cathedral, as well as through Nassau Court. And Nassau Court is the corner opposite British Colonial Hotel. Refreshments will be provided. We are also partnering with the Wellness Unit. So if you're interested in participating in the complimentary health screenings, feel free to come down and join us so that you have an opportunity to know your numbers. So 5:30 to 6:30 p.m., we invite you to join us tomorrow in Pompey Square. And then save the date for our next beneficiary educational session, Monday, September 14th. Continue to look out for our emails, our email blasts, as well as stay tuned on our social media outlets for more information on our next session. And then finally, I'm reiterating what Dr. Francis would have mentioned earlier on the importance of our annual physical examinations. The National Health Insurance Authority, we are promoting our annual wellness visit campaign this year. And so an annual examination matters because it's a preventative care opportunity. It allows you to identify any problems and health problems that your body may be facing early, and it also provides for better outcomes due to providing timely intervention. This annual wellness visit also is a personalized health advice, so your doctor can sit with you and offer tailored information as it relates to your diet, your exercise, lifestyle recommendations, and it's based on your current health status. And then it builds you a consistent medical history, and that allows you to track your changes over time, and it gives you a complete picture of your well-being. And so we are in the process of awarding though and recognizing those beneficiaries who are completing their annual physical. And so if you complete your annual physical, when you go to your NHI provider, ask them for a sticker place that sticker on somewhere on your attire, take a photo with that sticker, post that picture on social media, or you can WhatsApp it to our WhatsApp line at 813-2801. Tag us if you're posting it on social media, and you will be entered into a raffle to win some things. And we have good things. We have food store vouchers, we have John Bull gift certificates, we have gas vouchers, we have gift baskets. And so we want to reward you for taking charge of your health. And as we are in the process of creating healthier communities throughout the Commonwealth of the Bahamas. And so, should you need to contact us at NHI, feel free to reach out to us via our main line 396-8500, via WhatsApp 813-2801. You can send us an email info@nhibahamas.gov.bs, and our website is www.nhibahamas.gov.bs. You can also follow us on social media at NHI Bahamas on YouTube, Instagram, Facebook, LinkedIn, as well as Twitter. And so, like we would have mentioned, this evening session is going to be posted on YouTube in a few days. And so you're able to go on YouTube, like and share the video, as well as you can also access it on our Facebook page at NHI Bahamas. Thank you so much, Bahamas, for logging on and for taking time out of your evening to become informed about back to school health in your child. Please share this information with those that you know who may have children so that we can ensure that our children are also living healthy as well as long lives. Dr. Francis, we thank you again. Have a great evening, everyone.
Thank you. Good evening, everyone. Thank
Good
you.
evening, everyone.